Hi, and welcome to our April webinar, a collaborative presentation of the Federation for Children with Special Needs and the Recruitment, Training, and Support Center, otherwise known as RTSC. My name is Mary Beth Landy, and I am the Training and Support Specialist at RTSC. Today's webinar is Agreeing to Disagree, How to Effectively Resolve Disputes with School Districts, presented by Daniel Heffernan and Kevin Domingos, PhD. Dan is a partner with Coton, Crabtree, and Strong and concentrates his practice representing families with children with special needs in special education and civil rights, as well as personal injury matters. He served on the board of the Federation for Children with Special Needs since 1995. Dan has received numerous awards, too many to list, for his work in special education field, and has been named the super lawyer in special education every year since 2005. Dr. Kevin Domingos completed his education and training at the University of California, Irvine, and Harvard University. He has previously served on the board of the directors of the Massachusetts Neuropsychological Society. Kevin provides neuropsychological services to 12 schools in the greater Boston area. His specialties include forensic neuropsychology evaluations and reviews, independent medical evaluations, ADHD, traumatic brain injury, behavior management, and memory disorders.
Just as a reminder to everybody, this is going to be a two-part series, and it's a little bit reversed. What we're going to be talking about today is dispute resolution with the schools. The step two, or part two of this webinar, is going to be about the what comes just prior to that, the evaluation process. So many of you already signed up for the second part, so thank you for that. So we'll focus today on the part one, agreeing to disagree, how to effectively resolve disputes with school districts. If you look at this kind of overlapping Venn diagram here, what we'll see is part one is going to be about the legal aspects, and if we scroll through to the next one, learning objectives for today, to understand the special education process, knowing your rights, when and how to use an expert, learning effective measures for dispute resolution. Part two is going to be more about the evaluation process. So we're going to be talking a lot about a school-based evaluation. We're going to be talking about independent educational evaluation. We're going to be talking about private evaluations and maybe a combination of all of those. We're going to be talking about pain sources. So there's a lot of information about the entire process. I encourage you, if you have questions about the evaluation process, to actually send them in now for the talk in about 4 weeks. And then I'll try to definitely incorporate all of those questions into the talk as well. So as we go through, you can see some of the objectives that I have for the second talk. I wanted to get to know the audience a little bit, and Renee kind of looked at all of you out there. And there's a wide variety of individuals. There's a really good mix. Again, please send in your questions. We'll try to get to as many of them today as possible. However, if we don't, both of our contact informations are embedded in the talk. Feel free to reach out. We're here. Use this as a resource. Statistics. Special education in Massachusetts. Just to kind of put some numbers to this. 200,000 students eligible for special education services, 165,000 students on IEPs in Massachusetts, and 7,000 students in private special education schools. We're going to be talking about the special education process. Step one, a child is identified is possibly needing special education services, and this can be done either by a student who is complaining that they're struggling, or a teacher who's noticing that the child is struggling, or a parent or guardian who is noticing that there are some issues. Now, Again, next talk I'm going to go into greater detail about the process, but in between step 1 and 2, sometimes schools have other informal ways of dealing with some of the issues. For example, a child study team is something that is implemented. So there's an issue or a problem that's identified, and a child study team within the school comes together and attempts to resolve some of the issues. However, if that is found to be unsuccessful, you could then go directly to an evaluation of the child through an ECF or evaluation consent form. Again, we'll be talking about that later. It's important to put in writing that you want a formal evaluation versus just informally, because that is totally different, and we'll get to that in a bit. Of course, the team meeting, eligibility determination, if eligible, IEP is written. We should be close to step 5 now. The team drafts the IEP. The IEP is agreed upon or apportioned. So it's not an all or none phenomenon. You can actually disagree with a portion of the IEP. If everybody is in agreement to a portion of the IEP, it should not be held up. Services should be put in place immediately, and then the resolution for the other part should come later. Progress is something that is should be measurable rather than looking for non-measurable or quantifiable measures to see if there is progress. The IEP is reviewed, child is reevaluated at a minimum of every 3 years. I'm going to throw this next part over to Attorney Daniel Heffernan to look at the overriding principles of FAPE.
Thanks very much, Kevin, and thank you again to Renee and Mary Beth for fabulous work you do here. This is a great project that you work on. One of the key terms that we throw around a lot is FAPE, a free and appropriate education. It comes from a definition in this federal special education statutes. And it's talking about FAPE is the education for kids with disabilities. It's provided at public expense, under public supervision, and without charge to the families. It meets the standards of the State Educational Association. It includes an appropriate preschool, elementary, secondary education under state standards, because again, kids with disabilities are eligible for special education services from when they turn 3 to the earlier of them taking a high school diploma or turning 22 years old, and are in conformity with the child's IEP. Common issues you see that come up with FAPE, it must meet the standards. Determination of service is not based solely on the type of disability. So a school district can't say that, oh, well, here's the program that we have for kids with autism, or, this is our middle school program for kids with dyslexia or the like. It has to be individualized. That's a very important principle and idea to keep in mind when working on this stuff. There's no blanket reduction or elimination of services due to a type of disability or a change in the law. They're like, okay, now we're not doing services for kids with that disability or the like, or we're eliminating particular service. Oh, we don't do one-to-one aids anymore, or we're not doing individual speech therapy, things like that. Those are all impermissible. One of the key things is sort of a meaningful benefit, how we define that, and what constitutes what a school district has to provide in terms of FAPE. They've ordered an extensive array of special education services. So sometimes you have kids who are on IEPs or getting some pullouts for reading services, but it can go to an extensive array of services from different therapies and intensive programming. Again, it must be appropriate. The services have to be appropriate to meet the particular child's needs. That's a very, again, to overstate that is impossible. It's a very sort of important concept. And that there's a continuum of services that are required. So one of the principles also with FAPE is that there's access to the general curriculum. So the goal is to have a child with disabilities meet the same educational standards. So they should be learning math, they should be learning history, they should be learning English too, and sort of live up to the state standards. The general curriculum is distinguished from general education. It's based on the curriculum frameworks, regardless of the setting. They're still supposed to be working on that stuff. The IDA has been around for a long time. It was a sort of bipartisan effort when it was brought in. When it was reauthorized in 2004, there was a lot of stuff put in there, and Dr. Domingos touched on this as far as the measurable goals and things like that. That was a very important new focus, really, of the IDA, to how we're going to measure the goals and the like. Some things that are impermissible to consider with FAPE, again, sort of disability category. Cost of services is also something that's impermissible. If you go to a hearing on this, and one thing a hearing officer will cover their ears about is the cost of services, either from a school district saying, for us to do that, it would cost us $1 million a year, or the parent saying, all we're asking for something that's going to cost $100 a year. That's a totally impermissible consideration as far as what it constitutes FAPE. The caseloads or schedules of service providers, that's also something that's impermissible, because you find out, hey, we don't, our speech therapists are all flat out. They don't have time to do anything else or do any of the other services. We don't have an aide for the student. That's all impermissible. Openings or availabilities of classrooms. We have a language-based program for kids with dyslexia, but it's full. We really can't put anyone else in there. That's an impermissible consideration. Administrative convenience, as far as when people work to and the hours and things like that, that's not a permissible consideration. Conflicting school district policies or procedures. I always get a kick out of this when I have the school say, well, we have a policy that we don't do this. We have a policy we don't do one-to-one aids, or a policy about this. That is overridden by any of the federal statutes and state statutes about this stuff. So any procedures, just even though it's in writing or whatever from a school district, still does not trump any state laws or federal laws about this stuff. I was going to talk about some of the cases, significant cases. One that was watched very carefully by all of us in the special education area was a case that was decided by the Supreme Court last year called Andrew F. versus Douglas County. It was something we were all sort of fearful about how the decision was going to come down, because the Supreme Court had not spoken about what constitutes FAPE and sort of guidelines about what would be FAPE for a school district to provide a student since a case called Board of Education versus Rowley back in 1982. And the student in Rowley was in an inclusion program, and so it was a different situation than what happened with the student here, Andrew F., who had autism. He had been educated in the Colorado public schools from preschool until 4th grade, and then in 4th grade the parents placed him in a private special education school, wanted reimbursement from the school district for that, and also funding going forward. What caused sort of concern in the special education world is that the federal district court that reviewed the decision of the administrative body that ruled on the appropriateness of the child's IEP said had not made immense educational growth, but he at least made minimal progress, and that was okay. The 10th Circuit, the Court of Appeals, affirmed that, holding that the IEP was sufficient if it conveyed an educational benefit that was merely more than de minimis. So obviously that struck fear in a lot of us, saying a school district can say, well, kids made a little progress last year. They have dyslexia and maybe they're 3 or 4 years behind reading levels, but they gained a month last year, so that's sufficient. What also caused concern is Neil Gorsuch, who is the newest member of the Supreme Court, came from the 10th Circuit, didn't write this opinion, some people have thought he did, but wrote a similar one before that. So fortunately, the Supreme Court unanimously held that the de minimis standard that had been applied was inappropriate. They talked about the federal statute IDEA was an ambitious piece of legislation aimed at remedying a lot of sort of stagnation and lack of services for students with disability. And again, they reaffirmed some of the principles that came from Rowley and talking about the individual students. So what's the individual student's sort of needs, and what can you expect, what is to be expected as far as the progress. It's something I'm always, asking experts like Dr. Domingos. Okay, I have a student here. What would you expect their progress to be if they had an appropriate program? So notice they sort of quoted one of the good quotes from him is the focus on the particular child is the core of IDA. So the school district must provide an IEP that's reasonably calculated to enable the student to make progress, appropriate in the light of the student's particular circumstances. So the student in Raleigh was in an inclusion program. So the measure there was sort of keeping pace with non-disabled peers, and really they're sort of promoting from one grade to the next. But what to do in a situation, a student like Andrew, or a student has, significant cognitive disabilities or things like that, would you expect the progress to be great, moving from grade to grade? No, not necessarily. So again, it's focusing on the particular student's circumstances. And one of the lines from it that we've been sort of quoting is the Supreme Court says the IEP must be appropriately ambitious and the chance to meet challenging objectives.
Dan, can I just ask a question? Our parent has a child who's been on an IEP for 3 years, and it has auditory processing, specific language impairment, dyslexia, and anxiety, as shown by the evaluations. And the kindergarten is saying that she in fact their expectations are so low for her that she's making effective progress.
So that's a great question, because sometimes we're fighting about what the goals and objectives and expectations are. Because you can have, sometimes we're making a case that a student needs a more robust program or change in programming. And part of what we're looking at is the IEP that has the same goals and objectives sort of for several years. And you're saying, geez, by your own measures, they're not making that progress. But you also can challenge the goals and objectives of what you're sort of expecting for the child. And it's helpful to have sort of that good expert, backing to say, listen, they should really be making, more effective progress. And, really depends upon the individual child. But, say for example, it's a child with dyslexia where they have average or above average cognitive abilities. Most experts I know would sort of say with the proper interventions, that's a student who should be learning on grade level. So when they're, a year or 2 years behind, that's a sign that that's not an appropriate program, even though the school district may have in there as the goals and objectives in the IEP that they, it's fine for them to be at that level.
Okay, great, thank you.
I think the point that you made in the slide as well is appropriately ambitious. And a lot of times, an individual student, the argument is trajectory of that individual based on a disability or a specific diagnosis. But I think with appropriate intervention, the sky's the limit. We have to try to get that child up to their greatest potential and identify the limiting factors that are holding them back from reaching their full potential. And I think that's where the argument comes into play, is that trajectory, and it's important to make those points as well with the school.
Yeah, you're right. Thank you. The good news here in Massachusetts is not to be complacent about where we are in our laws and statutes, but it really didn't have much impact on the way we sort of practice in Massachusetts, the expectations. Maybe it's a sign of the times. It was a big sort of sigh of relief that there was not a more adverse decision from the Supreme Court. There's been a couple of the decisions from the special ed court here in Massachusetts that have quoted Andrew F., and usually adding sort of the appropriately ambitious overlay to their analysis. But for all intents and purposes, it really hasn't changed the sort of legal landscape here in Massachusetts. Another sort of key term and principle in special ed is about the least restrictive environment, that students are supposed to be educated to the maximum extent appropriate in the least restrictive environment. So the more you remove the student from the regular education environment, the more restrictive the environment is. And oftentimes it's sort of an appropriate move, but still there is a strong presumption in the law that they should be educated in the least restrictive environment. So you have a child who's in full inclusion, it's less restrictive, or it's more restrictive rather to go into some pullouts than a sub-separate classroom, private day school, and then a residential placement. So again, the more separated from the non-disabled peers, the more restrictive the environment is considered. So it just goes to show, if you're looking for a more restrictive environment, there is a hurdle that you have to get over. There's a strong presumption against that, and you have to establish why that's necessary. And we talk about the sort of the continuum. We have full inclusion, partial inclusion, a sub-separate classroom, so maybe it's within the school, but it's a separate classroom, day placement in a specialized program, and then the most restrictive environment is a residential placement where the student is 24/7 is going to be with kids with special needs.
Dan, I had a question for you regarding least restrictive environment. Do you find schools or school districts using that as a point when you're trying to argue with them in terms of the school doesn't want to provide the services because they're arguing least restrictive environment?
That's a good question. I do find that. I mean, a lot of the times, even though we in this area have fought so hard for our kids, our family members to be included as much as possible, there are times when we're pushing for a specialized placement or more services, and so we have that put on us as far as that's a more restrictive environment, and we have to sort of accept that that's sort of the hurdle we have to get over in trying to establish. And sometimes we're making the argument that a student is in a program within the high school, and there's the argument is that they're exposed to a lot of typical kids and a real range of kids, not just kids with special needs, and so to move them into that 100-student school is going to be much more restrictive for them. Mm-hmm. But on the flip side of it, and especially when you do an observation in some of your cases and for us, and say, well, this is a kid he has two peers, he's in that one classroom that's in the corner of the high school. He may go to the lunchroom, but he's not really included there. He doesn't have friends, sits by himself. So his world is so much more restricted in that environment than it is where he's going to have the run of the school and a lot of other students.
Exactly. I think least restrictive environment is an important concept, but sometimes I think the most important is best fit. And so best fit can mean a lot of different things. It's the personnel, it's the program, it's what is the best fit for that child to flourish. And sometimes it's not necessarily the least restrictive environment, although that's important. It's about the best fit as well. And I think that's really important distinction between the two.
Yeah.
I have a question from one of our participants about how to argue for a paraprofessional, one-on-one paraprofessional for the student when the school would rather do a sub-separate classroom. Any suggestions as to how to advocate for that?
I think it really obviously depends upon the situation, and again, so often with those sort of issues, I'm putting it to my expert. I'm saying, do we have the expert backing for saying that this is, that this is what we need? Kevin, can you say that this student needs a one-to-one aid? And I think as far as that's sort of an interesting question, because then you can have that sort of combination of preventing them from going into a sub-separate classroom in a more restrictive environment. Is that something that we can do to do that? Because I do have cases where the district is looking to move a student into a more restrictive environment, and we're arguing against that. Say, if you had more support to the student in the classroom, you wouldn't have to do that. So it's kind of a question that I put over to my expert. Okay, this is what the family is interested in. Is that something that you think that the student needs? Because sometimes we're arguing for more inclusion, but we're arguing that you have to do it better. That you have to do it with the supports and the services.
And there are districts that have argued over the fact that having a paraprofessional is actually more restrictive than a sub-separate classroom. So they're arguing least restrictive using just the opposite.
Yeah, no, that is a valid sort of consideration, and also especially if you have a teenager or an adolescent who I don't want to have the stigma or whatever it is of having someone with me and having a one-to-one aid, so I don't want to do that. So there are obviously the considerations that go into the individual case.
Okay.
Excellent.
Thank you.
I just wanted to give you sort of a sense of some of the cost of some of the programs. So here's a list of a few of them, and you can see the Carroll School is a school for kids with language-based learning disabilities. Cotting, the oldest private special education school in the country. Jermaine Lawrence, that's a residential program. Boston College Campus School, very well-known program. This is just to give you a sense of some of the cost of the programs, and obviously with New England Center for Children with their what they term as their severe program, it can be quite expensive. A little hard for private families to pay for, but also for school districts also too. One of the other key terms is, and this is something that's also very significant, and this is something I'm looking for Kevin to often help me with, is whether the student is making effective progress. So are they making effective progress? And then it goes back to that issue about what's to be expected of the child with their capabilities and the like. Whether it's not, it's more activities of daily living or independence, not just academic skills. Sorry to give a little advice about how to position to dealing with the school district. You obtain the relevant records. I think those of us who have work in this area of children with special needs, you get inundated. There's so much paper, so many reports and the like, and progress reports. It's important to be able to find some systems to keep track of them. Or if you're really getting to a point where you feel like you're going to have an issue with the school district, to get them. You have a right to get the records. Organize them. Find out what needs to be updated. I find that for myself. I'll request records, and 6 months later, if I'm ready to move the case, I got to make sure I've gotten the updated records from the families.
Can I just ask one question that is commonly asked? Do parents have a right to teachers' notes as part of the records? Are those considered part of the records? That's a great question.
What is, it's pretty broad what's considered part of a student's record. A student's record is something that, it's all the things we sort of imagine are part of the student's record as far as the transcripts and the like. But it's anything having to do with the student that identifies the students, then is then shared with someone else.
Okay.
And it's a great question as far as the teacher's notes, because that's meant to, the statute is meant to sort of have an exception for a teacher keeping their individual notes on a student. But once they sort of share it with someone else, it becomes part of the student record.
Okay.
I've been asked to do presentations sometimes to school personnel, because I have to lament some of the attorneys representing the school districts, where they have a teacher who says, sends an email to the occupational therapist, Johnny's coming down in half an hour for his OT session, and boy, is his mother a pain in the neck. And arguably that's part of the student's record, because it identified the student, it's shared with someone else, and the like. So emails, things like that, really should be considered. But a teacher's notes, they keep them just sort of privately. That's not typically part of the student record.
Great, thank you.
I think it's really important too for parents to understand organization, like you were saying. I've seen kind of both ends of the continuum, so to speak, very organized parents or advocates with all the information is there versus everything scattered at a meeting, and it makes all the difference in the world. Just having things at your disposal to look up quickly, but then to gather all the information as well, even from medical, from your pediatrician, if those are issues that need to be brought in, to have everything in one place that you can access. And be careful on internet. Anything digital, it's out there and could come back to you. So be very, very careful of what you put in writing.
That's very true.
We deal with a lot of special education surrogate parents. That's what our program trains. And one of the portions of the training is to document and keep documentation. When requesting student records, what would you say would be the appropriate time frame to say evaluation? Should they get the last 2 evaluations, or does that depend on whether we're talking about just 3-year evaluations? How many IEPs should they get?
I think it's helpful. I mean, I think I have 2 answers to it. If you're trying to gather all the records, you can send a request to sort of, I want the student's record. And so you make sure you have it, because there might be things that the family didn't get that's in the student record. And again, you can ask for sort of it to be broader as far as emails and things like that pertain to the student. Sometimes we have a fight about getting the raw data. particularly have kids on the spectrum and getting ABA programming and things like that. Frankly, typically for me, when I have a client coming to me, I'll usually ask them for their last couple of sets of evaluations or something. So, if I have a 16-year-old representative, I said, you don't have to go back to you don't have to go back to kindergarten or preschool to get the records. I think times that's overly burdensome for the family to try and gather that stuff. And I usually say to them, just give me what you have, but you don't have to go back last, a couple of years or a couple of evaluations. But I think for the surrogate parents, I think to just request the entire record. Now, typically, it can be a fair bit of stuff, but it's not as, it's funny when Kevin's talking about the medical records, sometimes they'll send a request to Children's Hospital but if it's a very medically involved kid, if a cardiac surgery, whatever, they'll respond to me, okay, we have, 20,000 pages of documents, that's gonna cost X amount, do you want all of that? I'm like, I really don't think I need that, maybe you'll just get the discharge summaries or something like that.
Okay.
So, you also, it's hard because you don't wanna get over and, inundated with the records too, and things you might not necessarily need.
Okay,
So,
great.
I think as far as, it's important to educate yourself, the process, there's so many good tools out there to sort of, learn the overviews of the thing, both on the Federation website. DESE has a good, overview of things. What your expectations are. A lot of times, working with families, sort of managing expectations about what, we can expect from this, this process. Again, one of the big things is the student is not entitled to the ideal program or the best program. They're entitled to what they require, what they need. So that's, that's what we're working with. That's sort of the legal landscape. Time about things. If a family comes to me now and wants to fight with the school district, we're kind of up against it to try and bring in, experts and the like to sort of, fight to get something in place for next fall. So it's important to know about the timing of the things. I think it's good to have a sense of the laws and regulations. Whether or not sometimes dealing with school districts, whether they don't understand things or they're ignoring certain things. So it's good to sort of know about timelines and what records I'm entitled to, what when the team has to reconvene, what my rights are as far as responding to an IEP, and also sort of the expense of things. What's sort of realistic about the the need for and the expense of evaluations, getting an observation of the program, having getting an attorney involved. All good questions to ask and educate yourself about. Thought we have a good photo. This is Kevin's last vacation. He went out to the Southwest, but we'll talk about sort of the do's and don'ts of with experts. And for me, one of the questions is, when do you bring in an expert? It's oftentimes, for me, I've said it before in this webinar, that it's often a battle of the experts. And the schools typically have experts at their disposal. They have the school psychologist, they have the speech language person, they have the OT and things like that. So I find that the district, and there's some very good people working for the districts, but they typically have the quantity of experts, and they also, on their side, and they also have the contact with the student, because they can say, we see the student 6 hours a day, and so we know them well, and we've known them for years. Important thing is, when I look at sort of the qualities of a good expert, someone who's recognized in their field, they have proper credentials, the licensing. These are all things you want to make sure that they're. It's helpful if if you can, if they have someone who's has a history with the student, they're a treater of the student, or they've worked with them. Maybe this is the second time, third time they've done an evaluation. If you can have someone who's worked for parents and for school districts, because then there's not seen as sort of a hired gun, one way or the other. And then someone who's not a shrinking violet. It's interesting. I always, in talking to neuropsychologists or speech language pathologists or whatever, I always say to them, you're in the helping professions. You're in the helping professions, Kevin. You're sort of a nice person and you're doing that stuff. I'm in the sort of eat raw meat profession and whatever, but it's not the same skill set. And so you need someone who is, is willing to sort of stand up and be able to say, in sometimes uncomfortable situations, sitting across the table from the school people. You don't have the you don't have the proper programming for this student, or this is your evaluation was off because of this, that, or the other thing. Without sort of burning bridges and whatever, but to be able to stand up, and that's I try and stay aware of the fact that personally I'm not someone who likes a lot of confrontation and the like, and conflict, but professionally I'm very comfortable with that. It's what I do. It's what I've been doing for 30 years. But it's not always the same skill set, and someone is able to do that. So I think I'm sorry.
I just wanted to add a little bit regarding kind of experts in general. It's really important, I think, if you are looking for an expert, it's not a one-size-fits-all. And I would do your due diligence and ask for a CV or a resume of the individual to look at their training, to see if they have expertise in a specific field or diagnostic category that pertains to you or the case. Neuropsychology, for example. In order to call yourself a neuropsychologist, there is not a licensed neuropsychologist. So in the state of Massachusetts, pretty much anybody can call themselves a neuropsychologist, but ethically, that's another story. So buyer beware. It's really important to do your due diligence, to look at the training, especially if you're requesting a neuropsych to be done in the school. Who actually did that evaluation? Are they a neuropsychologist? Do they have the training for diagnoses, especially for autism, for example? Did they give the gold standards in assessment, like ADOS 2, or not? So these are all questions that are really important to identify with your expert and the expert of the school, to really understand who is making these decisions and determinations.
One of the other things to qualities of an expert that I put a question mark next to as far as experienced witnesses, because, and I've had witnesses at hearings at trial, some who do a lot of that and can be very good and whatever. I've also had others who are testifying for the first time, and I don't really have a particular rule about that, because I think there is an appeal to say, I do a lot of this kind of work. I work with a lot of students. A lot of my patients have Down syndrome. It's the first time I've been in a hearing and the like. I think there's some appeal to that. But again, also it's helpful when someone you see what their track record is, they're sort of comfortable experiencing it. I think it's really more a matter of the quality of and then their ability to spend the time sort of preparing and prepare properly. I think it's good to have an expert who's willing to work with you as far as reviewing drafts. So it's so helpful to have that shared with the family, and they can say, well, no, this evaluation was done there, or at this point, or something like that. The willingness to advocate in a meeting or ultimately at a hearing. I know some experts, there's no way I'm going to go to a hearing, and I respect that, but their value in this, even though very few cases go to a hearing, is somewhat limited, because then sort of push comes to shove and you're down the line. You don't want to start it over and try and find some other expert or whatever. Someone understanding the legal landscape and interplay with opinions, phraseology, particularly in the area of the ideal program for this student is X. I say they're not entitled to the ideal program under the law, they're entitled to what they need. So if you think that's what it is, that the student needs that's the way I want you to write it. So some of our experts, sort of our do's and don'ts here, have to know the program, either through reviewing the IEP, contact with the teachers and other staff. Be explicit in your report as far as what you're recommending and the like. Describe the student's potential in the context of what is and can be expected from the student, what's effective and meaningful progress. Be specific as far as how the deficits can be addressed. What's the number of hours that you're saying that the student needs for this specialized service, and the like. Be aware of issues about home programming. Is this something about parent training that we're having the home programming service, or is it for a direct service? One of the things that school districts have a lot of deference in as far as the staffing to deliver services to the students, and it's a difficult thing to sort of challenge a school district on. And if you're looking for some specialized professional or person to be working with a student, you really need to have the expert backing. This person needs to have a, a master's level BCBA or a doctoral level or something like that, or they need to be a physical therapist, not a physical therapy associate or assistant or whatever. So if you can address that, then that's good to sort of put that, again, specify the number of hours. Oftentimes I'm going back with the school districts, we're looking for 10 hours of home services. The district says we'll offer 4. You want to have the sort of expert backing why you need that, amount, how many students need to be in the class. I just looked over a report before I came here. Student needs to be in a small class. Well, what does that mean? I mean, when I grew up, I had 50 students in my class in my elementary school, so a small class to me is 30 students. But again, if you mean 6 to 8 students, well, say 6 to 8 students.
We have a question regarding actually whether you should have your expert do a in-classroom observation, and the other half of the question was, and how do we get insurance to pay for that? But do you really feel that it is necessary for an evaluator, an independent evaluator, to observe the student in class?
It is a very important thing to have an observation if you're really going to battle with the school district about it, because for a couple reasons. It's instructive. You actually see what's going on, and that there's really no substitute for that. If you're wondering about how things are being delivered, or there's a representation of this is a program, this is an ABA program for students, or this is a program for students with dyslexia and language-based learning disability program. Well, actually, is it happening that way? What are the peers like? And from my perspective too, it just adds a lot of sort of credibility to the expert's opinion. And so I usually do, if it's really going to go far, I want to have the observation of the program, because you can imagine for me, if I'm at a hearing and I want to change of placement, the burden's on me to show their program, the school's program is inadequate and inappropriate, and I put I put Dr. Domingos on the stand, does a great job, expert report, well credentialed, says this program's not appropriate. I don't want the first question on cross-examination to be, Dr. Domingos, this program you just trashed and said it's not appropriate for this student. If I actually see it, if I actually gone to see it and see the other students and then talk to teachers and whatever. So I have situations where my experts say, I know that program well. I was in there last year. They haven't changed it. You need to go in with this student in mind. So, and getting it paid for is a challenging thing.
So the other part you were talking about, insurance to pay. So usually insurance will quote the term medical necessity. And so medical necessity is based on specific diagnoses that you're attempting to rule out. So anything academic has nothing to do with medical necessity. So it would just automatically, they would just throw that out because it's school-based, it's academically based, even though it's important and would help the case. If it's under the kind of realm or umbrella of academic or academic testing or purposes or IEP, they won't pay for any of that.
Okay, great, thank you.
Here's a few don'ts for the experts. A delay in report can be very problematic. Did the evaluation back in October, you're just getting the report now. Correct the typos, inaccuracies. It's just sort of that professionalism. Making conclusory statements without the sort of support why you're saying the student is not making progress or they need something in particular. I talked a little bit about the language ideal, preferable versus required, and failing to identify the disability. I think I've sort of typed it in here. That's a problem if they, aren't able to identify disability.
Just wanted to add a few more comments regarding the experts that you're looking to bring on. It's really important, again, to do your due diligence and to ask questions ahead of time. Ask what is the typical turnaround time of a report. Timelines are extremely important, and you don't want to miss deadlines or timelines. Typos, inaccuracies, we see these all the time. 15 years ago, we implemented professional copy editors for all of our reports to make sure that we minimize typos and inaccuracies as much as possible. It is very, very common, even in the medical field, to see inaccuracies. So that's extremely important when you're trying to present your case, that everything is accurate without, he, she problems or name issues. You definitely don't want that. And again, ask the expert, do you diagnose? Will you put in disability language? You are the expert. Even though it will eventually go to the IEP team, and it should be a team discussion, you are the expert, and you should have your report, specify disability qualification as well as strengths, because that's pulled right out of the report, should go right into the IEP, recommendations of course, but disability qualifications for sure.
This, you look at some of the cases, again, I've cited some of the cases, you can look them up. Having an evaluator that has the experience with the particular disability, hey, this is what I do a lot of. Having the up-to-date evaluations is a very important thing instead of, an older one. Being familiar with the proposed program, because you see the hearing officers and the weighing testimony at a hearing, they'll have the, school experts saying one thing, parents experts saying another. How are they going to decide which to sort of believe and give more weight to? So these are factors that help in that. Making specific recommendations. Again, failing to make those is really sort of problematic. And testify at a hearing, sometimes you can put the report in or testify at phone, but there's no substitute for being able to testify at the hearing.
So Dan, somebody has a question. Are you suggesting that reports should use phrases like ideal, preferable, required, necessary?
I think, I'm sorry if I'm a little unclear about that. What the law requires is that a school district provide what is required, what is appropriate for a student, what's adequate for a student, and the like. So, words like ideal are problematic. Words like better or the best or something like that. Same thing if I, break my leg. A doctor can say, well, the ideal treatment for you is put you in a cast for six weeks and then see how it goes and do physical therapy afterwards. And you say, well, is that what I need? And most doctors say, yes, that's what you need, but that's sort of the language that they use. Mm-hmm. So avoiding those, being mindful of the legal standard that it's what a student requires, what a student needs, instead of, oh, this would be great for them, or this would be even be better for them. Because even when you come down to a situation where you're fighting about an outside placement, specialized placement such as the Landmark School, and you can have everyone sit around, the school district people say, Landmark's a great place, we send kids to Landmark. Landmark would be so much better for the student than what we have, and they would do great there. But what we have is perfectly adequate and appropriate. We don't need to fund it. That is an accurate statement of the law. So being able to talk about what the student requires and needs is a key thing.
Okay. I always find the word benefit to be a tricky word, because wouldn't we all benefit from something?
Yeah, and that's, sometimes you find, say, every kid would benefit from being in a class of 6 to 8 students instead of 20, and things like that. So.
Okay.
One other piece, just to mention regarding the expert. So if you choose to bring in an expert and you want to compare what the school provided versus what you're attempting to provide, sometimes what we request is the raw data of the actual testing that the school performed. Now, by law, the school cannot release the raw data to a paraprofessional, a parent, a lawyer. It has to be a licensed individual. Clinical psychologist, school psychologist, neuropsychologist. But it's surprising, again, looking at errors in scoring could, we just want to have accurate information to compare. So sometimes requesting the raw data, going through and rescoring what the school did is beneficial to the case as well.
Great.
We have a slide. Actually, I think everybody should have access to some of these resources. I think Renee mentioned that she put it in PDF form. So there should be hyperlinks to download everything. For whatever reason, if the download does not work, If you go to our website, the information is there as well. So that's bostonneuropsych.com /resources or /abbreviations, as well as definition and terms. So all of that information is there. If for whatever reason you can't download it from the internet, send me an email and we'll definitely get it to you. Be happy to take some additional questions if people have those now.
You mentioned before, Kevin, that the appropriate people should diagnose, that they need to be credentialed. So who would those individuals be, or what are the credentials that they need?
Right, so it's really important, for example, if a parent guardian is wanting to assess autism, for example, or ADHD, and the school is attempting to do their own evaluation, is the individual providing that evaluation expert in diagnosing? So do they have the experience? You'd be surprised that sometimes the answer is no. They attempt to do that, but not in a comprehensive manner. So sometimes during an independent educational evaluation, we would make sure that we'd have an appropriate expert providing the evaluation, and then discuss with the school, who exactly provided the information. Can you give us their training? And again, I think from a legal perspective, I don't know if you routinely do that at all, Dan, but just to compare who exactly did the evaluation in the school and what are their credentials versus somebody who has, training from Children's Hospital, who, did 2 years of ADOS training under supervision versus going to a 2-day seminar. It's just apples and oranges. So unfortunately, you can call yourself trained, but buyer beware.
I think that's a great sort of point, and what I look for as far as bringing an expert in. I think sometimes, though, parents feel that they should refuse to let the school district do their evaluation with their person. Right. And I advise against that for a few reasons. One of which, sometimes disputes get resolved because then their expert sort of agrees with our expert, and then they're on the same page. But also sort of the time to have a fight about the qualifications and the like about that evaluation is not at that point, sort of that entry point. It's sort of later on, because then if I say, well, here's my expert who's does this a lot, and here's their training credentials, and here's your expert, either I'm playing that out in front of a hearing officer, then that puts you in a sort of a stronger position. And I think also there's the feeling on the school district, they have people they trust, so they want their people to maybe do an additional one or a parallel evaluation. And then also that there's that feeling of mistrust. Why are you hiding the student from us? Why aren't you letting us, evaluate them or observe them or the like? So usually I'm advising to let them, have their evaluation, have their shot. We're going to also have our experts. So.
For sure.
The process doesn't have to be adversarial, and sometimes actually we've negotiated with both sides to say, we'll provide an expert to provide the assessment process for both sides, because some of our experts actually have done work for the schools, some experts have done work for parents. So in that situation, that a good clinician will report on the data for the good of the student. And if everybody is on the same page, the process doesn't have to be, adversarial at all.
Great. We do a lot of work around trauma, particularly for the kiddos that are in DCF custody or the juvenile justice system. And so someone has a question about what expectations can they have for the school districts to do trauma-informed evaluations?
Again, it's whatever the student sort of requires and needs. I think sometimes you have that feeling, and this may happen with a lot of the people you're working with in this project, is the, if the school saying, hey, this is a home issue, or this is, happening outside, it's not really sort of our responsibility. But you take the kid as you find them. And so, if a kid has a learning disability because the parents didn't do anything with them sort of growing up, or any sort of stimulation, as opposed to the parents who did, everything and whatever, it doesn't matter. It's sort of what the student needs. And the same thing you find with the trauma. So I think you do want people who have, if you can say, as far as that expertise in that, because if that's a big, part of what's going on with them, you want someone who has that sort of background. And I think that's very true with the mental health stuff, that you want someone who has that expertise and that background, so that sensitivity, but also how that is impacting, a lot of the things, and also how the learning disabilities sometimes, and they're feeding off each other,
Mm-hmm.
and also sort of impacting them. So.
Great.
Just to add to that, a lot of times there's multifactorial issues going
Mhm.
on, but it really is a specialized training, especially for trauma, for individual counseling as well as assessment. In schools, typically, the closest thing to a psychological evaluation is a social emotional eval,
Mhm.
which is called in schools sometimes, and it's an attempt to address these issues. In private practice, it's considered a psychological evaluation, similar but different. And a lot of schools focus on more of a social, emotional component, but really trauma is something totally separate, and requires a much deeper training skill set, as well as focused evaluation for that piece as well.
Okay, great. An IEE question, independent education evaluation question. What are your options if a child needs an evaluation, the district agrees, but requires state rates, and they're having difficulty finding someone thorough and compelling at such a low rate? Does a child, and the child doesn't have what they're terming an unusual disability, or circumstances such as a reading evaluation,
Right.
what are the steps that parents can take?
Sure. Great question. Thank you for sharing that question. So a school is not mandated to accept the state rate. It's a suggestion, and oftentimes it's a negotiation, really. And especially if there are specific issues where you're not going to be able to find someone who speaks Spanish to do, a Spanish evaluation, or Portuguese, or to address trauma, or whatever the case may be. But if you find an expert, it is a negotiation, and we do this all the time. We have a discounted rate. It's not always the state rate per se, but it is a reduced rate for the schools, but it's extremely comprehensive. So the bottom line is it's a negotiation, really. So the school has the ability to pay not just the state rate, because there's many, many factors that influence that as well.
Okay, great. We have a parent who has a child that was denied an IEP. Then the problem reemerges the next year. Do they need to have a reevaluation done at that point, or in order to try and get the child an IEP?
I would say they should, and they can put it to the school district. When you have this sort of denial of eligibility, whether or not you should challenge that. But sometimes you're going back, okay, you want to get an evaluation, and you can, challenge that. So I think it's good to sort of put the new information in front of the school district.
Okay, great.
Thank you again. I think we're just about out of time, but wanted to again thank Attorney Heffernan, Mary Beth, and Renee for inviting us, and thank you for your participation. Renee tells me that there's already over 100 people signed up for the next webinar. Thank you for that, and send in your questions, and we'll try to answer as many of them as possible next time around. And again, if you have any issues or problems with resources, please feel free to reach out, and we'll try to get those to you as well. Thanks.
Thank you to both of you for coming in. That was extremely informative. I'd like to remind everyone that you will receive a follow-up survey, which we ask you to complete. We value this information so that we can provide everyone with the most effective information to support the wonderful work that you do in supporting children. As a quick reminder, please remember to sign up for the upcoming network series with Liz Topaz about the MCAS, access, and achievement for students with disabilities. That is on April 26th. And join us for part 2 of the presentation, everything you need to know about evaluations but we're afraid to ask. Don't be afraid, please ask. And we'll be holding that on May 15th. And also join us Friday evening, May 18th, for the Federation's Gala 2018. Celebrate Every Child. It is held at the Weston Waterfront Hotel, and tickets for this event can be purchased through the Federation's homepage. Thank you again, everyone, for joining us, and have a great day.